Hello everyone. My name is Feng. I'm recording this because I want to record my chickens in the background. I love them. They are my pets. Um, I'm kind of tired. I just finished my overnight shift at the psych hospital. So yeah, I'm very excited about taking the pharmacology class. Here's my boy. His name is Lucky. I have I have like 46 chickens. Um, So I am enrolled in the Master Science of Nursing program with the concentration on the psychiatric mental health nursing practitioner track. So I chose this specialty because mental health has always been something I've been doing at work. I work at the mental health hospital before, and then I worked 6 years at a state prison in California where many of the patients have severe mental health illnesses. So it's just feel natural to go into a psych MP track. So now professionally right now, like I said, I work at a psych hospital as a charge nurse, and our clientele's come with a lot of patients that want on a 5150 or 5250 hold for danger to self, danger to others, or gravely disabled patients. So it's kind of challenging sometimes just to make sure they are staying safe while they going through mental health crisis. But I do enjoy very much working with patients, and while focusing on my psych MP curriculums, which really teach me a lot about how better to manage these patients' psych symptoms. So, I feel like I'm helping them in many ways. So, look forward to learning more. So, when I hear about pharmacology, the first thing that comes to my mind is responsibilities, because medications really can, really improve someone's quality of life. But at the same time, if it's not managed well, the uh, the side effects and then can be very severe also. And so, my chickens, hey boy. So so we really have to know the actions, the mechanism. He's so cute. uh, and what are the better choices of medication for different kind of diagnosis like schizophrenia or bipolar. Hey boy, he loved being around me. So so I feel like, as a nurse and gonna be a psych NP in the future, we have a lot of responsibility to know our medication well and prescribe the medication that is appropriate for the patient's mental health conditions. So, with this course, my boy. With this course, I have three main goals. First is to develop a stronger understanding of, the pharmacodynamic of the medications, the psych meds, and, other medical. He's just pecking me right now. Stop it. He's a rooster. He can't help it. And also with regards to how different medication works, their side effects, and how they affect the brain, the behaviors. He's trying to kill me. And then also, I want to build confidence on how to safely select and manage medications, and for patients with different mental health illnesses. Also, I hope to improve my ability to educate patients about their medications, and so they can feel informed, empowered, and they feel supported in their treatment plans. So in terms of pharmacology topics, I'm particularly interested in learning more about medications that to use to treat anxiety disorders, depressions, mood disorders, and these conditions are so common in our clinical practices, especially in the psych hospitals. So I'm very interested in understanding how this medication works, how to manage them, how can they be combined with therapeutic approaches like such as some holistic treatment plan or psychotherapy or behavior modification. So so that's because treating people's is motive angle approach is not just medications. So looking ahead, my future practice plans include just continue working at the psych hospital as a NP prescribing medications, and I can help improve access to people with mental health illnesses, and also like to do some telepsych, so people who are in areas that doesn't have access to psych mental health providers, they can do online, so you have easier access. And finally, with regards to how my worldview is reflecting on the SAU's concept, so I I know that the Christian worldview is about perspectives that interest about how knowledge, ethics, and human relationship through teaching and example of the Jesus Christ, and that it emphasized the belief of everyone is created with the inherited dignity and worth in the image of God, and it also guides how individuals treat each others and with compassion, respect, and dignity. So in my healthcare education practice, you know, I believe that a Christian worldview should encourage, a nursing practice in involving faith, knowledge, and services to, promote holistic approaches and addresses not only physical but also psychological needs, so and this worldview is really, reflecting with my commitment to my learning through the lens of Christ and the value of Christ, and how I really want to engage in Christian actions through my nursing practices. So, so when I using my Christian worldview through pharmacology practices, I do also want to involve, being having ethical medication management and managing patients' treatment plans and involving Christian worldviews and with compassion, dignity, and also making sure that the patients are always with you know providing the safety and offering autonomy and with regards to the patient's well-being as my priority. So that's it. I'm sure you can hear my chickens in the back. Actually, I live in California, in King City, and I have 9 cats, and I have a lot of chickens and 7 dogs. I love them. Anyway, okay, that's a lot already. Bye.